we step into my article, let's have a quick look at news. Actor and singer Lian Huang was found dead at his home in Taipei. But it is a pretty sad incident, but do you guys know why he died? And I offer some options for you to choose. And the first one is suicide, the second one is concussion, the third one is aortic dissection, the fourth one is stroke, and the fifth one is he heard the aliens calling. So choose your answer.
C.
Yeah, but the answer is C and E. I will tell you why. Because some people say that alien Huang hear the calling from the alien, so he returned to his own planet, and the body was suffering aortic dissection and died. And that's a picture. But however, our technology are not so advanced to know what happened in the planet, but we can know about the aortic dissection. So I'm going to talk about the aortic dissection. And this is the table of my contents. The first part will be, I will give a brief introduction of the aorta and the aortic dissection. And the second one, I will show you guys how to diagnose the symptoms of the disease. And the next one will be how to prevent it. Okay, since most of us are not quite familiar with the cardiovascular system in our body, so I will first talk about the aorta and the vessels to help you understand better when I will introduce the aortic dissection. Okay, let's get started. The aorta is the largest and the main artery in our body, and it is separated into three areas. That is ascending aorta, arches of aorta, and descending aorta. And the job of aorta is distributing the oxygenated blood into all vital organs. And the blood will begin in the ascending aorta, and then he will start from the left ventricle and then enter the ascending aorta, and then go through the descending aorta to the abdomen. And in the abdomen, it will distribute into two smaller streams. And the arches of the aorta is the crossing between the ascending aorta and descending aorta. And as for the blood vessels, it is made up of three layers. That is, the first layer is tunica intima, and the second layer is tunica media, and the last layer is tunica adventitia. The tunica intima is the inner layer, and it is also the thinnest among all the layers. And it is made out of endothelium and supported by connective tissues and elastic fibers. And surrounding the tunica intima is the tunica media. And all the connective tissues and elastic fibers will run parallel to the vessel. And tunica media is the place between tunica intima and tunica adventitia. It is made out of connective tissues and elastic fibers, and also the smooth muscle. And the tunica media in arteries is thicker than the one in veins. The outermost layer is tunica adventitia. It is only made out of connective tissues and elastic fibers. Okay, now that we know what is aorta and the structure of are vessels. Let's look at aorta dissection. This is a picture of an normal aorta. And aortic dissection is caused by the rupture in the tunica intima. So the blood will flow into the torn part and forming a false lumen. So due to the formation of false lumen, the aortic lumen is divided into two, and the false lumen will often appraise the true lumen. That causes the insufficiency in the blood supply, and also it could cause also since the false lumen is not the complete structure of our blood wall, it will be fragile and easy to rupture. And the aortic dissection is classified into two types. And because the treatments and the risks can be different, so it will be pretty crucial to diagnose the type accurately. And the first type is type A. As long as your tear includes the ascending aorta, it will be type A. And type B is when the tear locates in the lower aorta, that is descending aorta. And in comparison with type A, type A, if the tear isn't located in the ascending aorta, it will be type B. So the key part is the ascending aorta. Okay, now I'm going to tell you some symptoms and complications of the disease. So when you have this concept in mind, you can have a self-diagnosis to see whether you have it or not. And the symptoms is similar to those of heart problems, such as heart attack. And the symptoms occurs as a consequence of your reduced blood supply to organs, or the pressure on your organs caused by the blood clot. And the first one is chest and back pain. It is also often described as a tearing sensation that penetrates to your neck and down to your back. And leg numbness and tingling, lost consciousness, and the feeling of having a stroke. So the feeling includes a sudden difficulty in speaking, or loss of vision, or even one-side paralysis. And abdominal pain is also included in the symptoms. Complications include cardiovascular disease. Since we know that aorta is one of the cardiovascular organs, it is pretty possible that it will interfere its value. So, and for example, when the rupture occurs occurs around the heart, the fluid will build up around the heart and form a compression. That is called cardiac component. And the second could be organ damage, such as internal damage or kidney failure. And the most severe one is death, because you have a severe inner bleeding. Okay, now if you feel like you don't have any symptoms, I mentioned the book, then congratulations. But don't get too cocky too soon, because there might be some risk factors that will bring you into aortic dissection. So I'm going to show you guys some risk factors, and of course the most important part, preventions. Risk factors. We all know that genetic disease is the strongest factor to the disease, but such as Turner syndrome or Marfan syndrome. You don't have, so you don't know. Okay, so I'm not going to talk about that since I think most of us are healthy enough. But I'm talking about the potential factors that is closely related to most of us. To our surprise, age and sex actually make a big matters. Let's look at a chart of people with aortic dissection. We can see that men are about double the incidence of aortic dissection than women, and the peak range between 50s to 80s. So we have a conclusion that is males are more likely to have the disease than females, and the elderly are in higher risks. Okay. After you hear the article above, you found that you don't have the symptoms, nor do you have the possible risk factors. So I would say that you are under the God's blessing, and I will offer some preventions for you to maintain in this good situation. There are 4 tips. The first one is monitor blood pressure regularly. You can buy the blood pressure devices at home, so you can maintain your blood pressure in a good way. And the second one is wearing a seatbelt. Since trauma to our chest often leads to aortic dissection, so you can help by wearing a seatbelt when you are taking a ride. And the third one is quit smoking, since smoking will lead to the raise of your blood pressure. And the last one is healthy weight, maintaining a healthy weight. Obese people are more likely than the people who weigh within a normal range to have high blood pressure. And so to maintain a healthy weight, doctors suggest that you can try balanced diet and getting regular exercise. After hearing so many new things above, I believe you might worry that you are the one with aortic dissection. But believe me, if you follow doctor's instruction, you will be fine, just like having a brush with the dead. At the end of my presentation, I want to share my feelings about this sad incident. Huang's death bring many people sadness, and people mourn for him, but also thank him for the joy and kindness he brings to everyone else. And aortic dissection, the same disease that occurred to Huang, will occur to anyone at any time without warning. That's why we need to live in the present and and try your best to love, to help, and to pursue your dream. And live just like Huang once said. You only live once, so seize the day. Spring with all out effort and never look back. Thank you.